right, hello, and happy Thursday, everyone. Today is gonna be a wonderful day because the sun is out. I know that here in Southern California, where I am in northern San Diego, the sun is out and shining, and everybody is having a wonderful walk or jogging or riding bicycle around here. So, our exercise is very good. So today, our tea time with Sydney is Thursday, 3 p.m. PST. So welcome. If you're joining us, welcome to my Thursday tea time with Sydney. And as you know, I come online here every Thursday to talk about certain health topics that come out either in my life or in my clinical practice or some of the patients that I come across and sharing the experiences, or also some of the techniques and tips from the Chinese medicine perspective. So today we will talk about a health topic that most of us don't want to talk about. It's sort of embarrassing and sometimes can be too much information and too personal as well. So, but I want to talk about this because it's really important and relevant. And I see a few cases already this year so far, and I want to provide a safe space without any judgment, also without any other comments. Because if somebody you love or you yourself have experienced this, then you know what I'm talking about, and you know that also that it's important to talk about it. So before we start, make your tea and come on over so that you can join me today. And then another welcome to everybody that's joining us. So today I want to share with you recent experience of what I've seen in my practice, and it's called patients who come in who have hemorrhoids. I know it's not only happening with older folks, but also younger ones as well. So before you brush me aside and say, oh no, we don't want to talk about this, take a moment to maybe just listen and have an open mind. Okay, so I have been seeing a few female patients recently who have complained about hemorrhoids. And you know what? It's very interesting because we think when we talk about hemorrhoids, it only happens to a certain age group. But like the COVID-19, we know that it just does not happen only with the older population, but also younger as well. So the thing goes with hemorrhoids, because we see that happening in the younger generation due to certain conditions that's happening in life. Number one, pregnancy. And number two, also change of diet causing constipation. So in my practice, I recently saw a lady in the early 30s and in her third trimester of pregnancy who is suffering from this, and another lady who is in her early 40s who have also problems with the constipation, and so the hemorrhoid is a problem. So they both came to me as they have other main conditions going on, and hemorrhoids were just a side note. So they came and say to me, I have been having this, last week or so. It comes on and off. It's not consistent, but I thought you might be able to take care of it because, it has to do with some condition I'm also experiencing right now. So I did acupuncture on the meridian points that travel along the pelvic region to help them relieve pain, and also gave them some very good herbs combination for healing. So the thing with this hemorrhoid is that it has brought to my attention that most of the time we don't talk about this until it becomes a big problem. When sitting becomes too painful, or going to the bathroom becomes an ordeal. Or sometimes, you also have some other symptoms like bleeding, okay, and also pain, walking. So let's shed some light on this, and bear with me. I understand it's not a sexy topic to talk about, but it's worth the time and have the knowledge to have in your back pocket when you need it. And when the time comes, whether it's for you or for your children or for your partner in life, you know what to do and how to best help them. I will also share with you an acupuncture point that you can do yourself using pressure point to relieve pain in this area, and that's very helpful. But first thing first, let's look at the three what, the W, the what, when, why, and the how. So what is it? So hemorrhoids is a swollen and inflamed veins in the rectum and also the anus area that cause discomfort and bleeding. And as we have seen from the two cases in my clinic, it's caused by straining during bowel movements, also obesity, chronic constipation, and also pregnancy. So when does this happen? So this, because in the clinic I see patients who have chronic constipation. Usually we can resolve this in a short amount of time. But if you have consistently dry stool, or you don't go to the bathroom for 2 or 3 days, and then you go and you strain, and this can cause tears along the soft tissue in the rectum or the anus area. And also, as we can see, pregnancy can also cause the weight bearing on the lower part of the body, and also cause strain in this area as well. So no matter what, which part you're coming from, whether you're pregnant or you have chronic constipation or you put on some weight, this can cause discomfort when sitting or walking, and most of the time also is very itchy and also bleeding. So it's not very comfortable, of course, when you need to work or walk or drive or do your daily stuff. And let's take a look at why that it happens. So for dry stools or chronic constipation, we have to really look at our diet to include a lot of fluids, so that we can, what in Chinese medicine call, we float the boat. So we float the boat means that we make sure that we have a bowel movement every single day. And I will talk about this a little bit also in a little bit later. And for pregnancy, also watch the diet, include soft food. Soft food will help to prevent straining, and also help to when you go to the bathroom as well. And how long does it last for? It can last for a short time. If it's short time, you can do some self-care and it goes away. But some of this condition can last for a long time, and if untreated, you need to see your physician. The good news is, if it's a small, then you can do your self-diagnosing. So meaning you can treat it yourself with when it's small, or also seek a medical help when you don't resolve it. So common treatment for self-care is, of course, include high fiber diet, and there's lots of fruits and vegetables in your diet. Also, I always recommend, when you cook your food, don't bake, no toasting, and no what we call baking too long, because that takes away the fluids, the most water content from the fruits and vegetables. So possible you saute, you steam, or you stir fry any foods that you eat. That includes all the vegetables. And then for pain or swelling, use an ice pack or cold compress. That helps as well. And we have also witch hazel extract for washing, and also to put on a pad when you have your underwear. So that helps to keep it really help it heal, and also prevent pain. Another one I recommend also is zinc oxide for external application, and that's very good to help healing in this area as well, healing the soft tissue. And then also, if you can find preparation H in a drugstore, you can use that too. That's the common over-the-counter medication you can use. But currently, there's been studies that show that the preparation H can raise blood pressure. So the rise in blood pressure can cause sometimes headache, sleeping problems, and if you have high blood pressure, it can be a concern, because preparation H contains a chemical called phenylephrine. So phenylephrine is a blood vessel constrictor. So blood vessel constrictor, if you have any blood pressure problems, thyroid problems, or if you're diabetic, then this is not a medication that you can use. So check with your primary care before you self-medicate, because it does raise blood pressure. And if you have any conditions, thyroid or high blood pressure or diabetic, this is not good for you. And other ways that you can help heal is using soak. Okay, soaking in a warm bath tub or like a sitz bath with some essential oil. And after you use a bathroom, this is a good way to relieve some pressure and pain. In Chinese medicine, we have a few herbs that I recommend for healing. It's a formula called saffora flower or saffora powder. And this formula contains this, we call the Japanese saffora flower formulation or huaihua san. This is the best herb formulation that we use because it contains 4 other herbs that help to heal. And the saffora flower is very good for external healing for the rectum area as well. So this formula cools the blood, it stops bleeding, it clears the pressure, and resolves any hardening. So hardening here means it relaxes the small intestine area and also helps to cool the blood. So cool the blood, it will help to heal and stop bleeding. So this is one herb that you can actually get from your acupuncturist or your Chinese medicine doctor when you can, and it helps to use it. You can take the herbs. It's a tea form, also capsule form, and you can take it every day for the next 3 to 4 weeks to help to heal from the internally. And so for Western medicine, the common medication used is steroid such as hydrocortisone suppository, and that helps to really prevent pain and also to heal the tissue as well. And of course, some dietary supplements to help as well. And if condition get worse, of course, surgery is the next step. Some surgery is considered necessary when you have it chronic. We do the cauterization, freezing, or rubber band ligation, or stapling of the hemorrhoidopexy surgery, we call it. And if the condition is minor, here is one acupressure point that you can apply for yourself, on yourself. I'm going to pull up the image here. So here we have, it's called UB57, Chen San, which is translated into supporting the mountain point. This is located on the lower leg, as you can see, in the depression formed below the bellies of the gastrocnemius muscle when the muscle is flexed. So here UB57 is a really good point to use for hemorrhoids, and you can apply pressure using your thumb at this point. And this point is really good. It's one of the, we call it empirical point for hemorrhoids. It's used for hemorrhoids, constipation. We also use this point for spasm and pain of the lumbar and the leg. This point is helpful to relax the sinews. We help to activate the meridian because this meridian travels up to the pelvic region area. It treats also the heel and the foot, and the number 1 point for hemorrhoids. So UB57. So this point and other tips that I mentioned earlier for self-care is important. And also as for diet, again, intake of fresh fruits, vegetables in its natural form is best. And then stay away from any baked food or dry food like crackers and nuts. Because those will harden the stools, and then that will cause more problem in straining. So soft food, lots of high vegetables and fruits in water content, and when you cook them, just maintain the water condition of the food so that it will help you to have what we call float the boat. Yes. So again, if this condition goes on, please seek medical attention, contact your doctor or your primary care physician. Do not suffer in silence. noting that hemorrhoids is a small problem, because once it becomes a big problem, then it's hard to handle. And we want to take care of this before it gets worse. No matter how old you are, it is no discrimination of the age or the sex you are, whether male or female, because these conditions are very common. So today we have looked at the what are hemorrhoids, why it happened, how to treat it, and some tips for self-care and acupressure point to use. If you like this episode, and if you have checked out my previous episodes of videos as well, and I want you to enjoy the rest of this, please take this fun quiz that I have made, and I will put a link here so that you can take a look. So here we go. So the quiz I have is called Which Premenstrual Animal Are You? Premenstrual is a PMS animal are you? As you know, Chinese astrology, we have 12 animal signs. So 12 animal signs, each of them has its own characteristic. So each of them has characteristics. So when you talk about your PMS, we want to actually link that to a certain kind of personalities of the 12 zodiac sign. That way you will look at the some of the symptoms and what are the ways that I would recommend in the quiz that you can actually help yourself to relieve some of the PMS symptoms that you might be experiencing. So take this quiz. It's at siennichong.com/DZI8, siennichong.com/DZI8. And so I love to hear from you. Your feedback and comments are important to me. Post here in the comment section below and say hi, and let me know if you have any other suggestions of topics or other health and self-care topics that you'd like to know. So thank you for watching. Take care. I'll see you soon. Have a great week. Bye for now.